Hi guys, this is Azar again, Doctor of Physical Therapy. Today I want to talk about one of the kind of common problems of the finger, which is trigger finger or snap finger. What happens during that problem is some people experience that, which is happening usually on not on the thumb, on the other fingers, and then people usually do flex, and when they try to open the fingers, they feel a crack, click, and it doesn't want to open. So during that motion, somehow they feel that something is restricting the movement to open, and they get crack and then opens. Sometimes it doesn't even open, just stuck. Usually early in the morning, usually for people that have osteoarthritis, usually for people that have rheumatoid arthritis, that can be really severe. But usually for people that have repetitive movement like gardening or using the fingers a lot, like assembly jobs and stuff like that, or people that have trauma on the tendons for a long time, they can get that tendon sheet inflammation, and the tendon gets stuck while trying to do movement. So I'm going to show you the tendon of the thumb, like here. This is the tendon of actually the second finger. Is not that common in the thumb. It's either second, third, or fourth, or fifth finger. Usually at the base of the finger, the tendon, the pulley system that can get out of a tendon right of the flexors, and they go underneath carpal tunnel, which I already talked about in the last sessions, and the tendon goes through each finger, right? And the base of the finger, we get some knots and nodules in the tendon sheet, and that knots or nodules doesn't let that tendon move freely inside the tendon sheet, so somehow it gets stuck. Okay, and then imagine this inflamed part right here, this inflamed part, that like a nodule, it doesn't let that movement happen freely. So what we do, the first thing that we can do is again the scar tissue massage or cross friction massage. We can find, it might be that problem with this part of the finger, might be problem with this part of the finger. But anyways, with the base of a tendon usually gets involved right here. So you find the area of the nodules down here and start massaging it and releasing it. Sometimes it could be a little higher too. You can do it here, but most likely is here. Okay? And then you're gonna massage really hard and try to get rid of that nodule or scar tissue on the tendon sheet. And then sometimes you can hold on to this with your hand and go through the motion. Okay? That helps you to release that tension of a tendon. Another thing you want to do, just simply do the range of motion of the finger, any finger that's involved. Do the range of motion of the finger daily, maybe 20 of these daily. Another thing you need to do is the range of motion of the end range, right, or stretching. So we're going to do the end range of motion, relax, or stretching. Okay. We can do the end range of motion of flexion. That might be more painful. Okay. Trying to release that. Another thing can really help is anti-inflammatory stuff like ultrasound or laser right on the area of the nodule or inflammation or scar tissue. That can really help too. That stretch, the end range stretch, we had this stretch in the prayer stretch in the carpal tunnel, remember that? But now we are having this one. That stretch is going to help. And we had this as a test for carpal tunnel, now we do this one instead. Right? That helps with the movement of this, and then we can do a lot of movement, and we start doing it against the resistance, like extending. Remember you had abduction in the De Quervain syndrome. Now we try to extend all the fingers against that. So we go up against this, right? And we can flex against this, down against this. So snapping finger or trigger finger can be simply treated with a lot of stretches and strengthening, and we can do the anti-inflammatory stuff in the physical therapy, or occupational therapists, they can help you with that also. If that trigger finger doesn't disappear, you might need some injections or even surgical release, but most likely it can go away by these exercises. Sometimes it can come from the up higher problems like the neck. Usually people with the neck issue, they get a lot of snap fingers because the nerve issue doesn't let the tendons and muscles on the hand do regular movement, and that can affect that fingers. Eventually the grip strengthening and pinch strengthening problems that can happen because of the neck issue, that can cause the tendon issues on the finger too. But it could be secondary to the neck problem, but usually is a problem that's involved that area, especially in the palmar area. You get nodules on the base of the finger. You need to take care of that until you can get free movement of the fingers. Thank you for watching. I hope it could help you. Have a great day.